Those of us that have practiced nutritional or orthomolecular medicine have known for years that essential fatty acids protect against arrhythmias and against heart attacks and strokes. And finally, an article has come out in Diabetes Care in November of 2011 showing exactly that in diabetics who've had a previous heart attack. This is big news for the mainstream medicine, even though it's relatively old news for those of us who have been practicing nutritional medicine for the last 30, 40 years. What they found is they did a study on about 1,000 people who were diabetics who had had a heart attack in the past 10 years. And they were all between 60 and 80 years old. And then they compared those to people who were only on drug therapy, the best drug therapy. And these patients are on drug therapy as well. So the difference was is they were getting about 2 grams a day of essentially something that had EPA, DHA, and ALA. And I'll explain that in just a second here. Essential fatty acids, first of all, are essential for life. If we don't have them, we can't survive, and we can't make them ourselves. So we have to consume them either by eating fish or consuming fish oil products or krill or something of that nature, or using plants and seeds that have essential fatty acids in them. Our body has to convert what's in the seeds and nuts, which is alpha-linolenic acid, into its down-chain metabolites, which include EPA, which is a powerful anticoagulant, and DHA, which is a powerful antiarrhythmic agent. And of course, the parent product, the alpha-linolenic acid, is where all this comes from. The body has to have certain enzymes to be able to do that. It has to have delta-5 and delta-6 desaturase enzymes, or it can't make the conversion. And if you can't make the conversion, then the alpha-linolenic acid that you take in seeds and nuts doesn't do you a whole lot of good unless you take massive amounts. So that's why we tend to use fish oil or krill oil, which has, the fish has already done the work for you of making the EPA and DHA, which does the work. So that's how essential fatty acid metabolism works. We have good data showing that essential fatty acids protect against clots, against arrhythmias, and against heart attacks. And they work as well as the drugs do. We have no drugs in medicine that work any better than EPA and DHA at doing these particular jobs that it does. You would think that the way cardiologists use their medications, that there's a big difference. But in fact, now we know, particularly with an article like this coming out in a prestigious journal like Diabetes Care, that what we have here is something that is really an important finding. And the reason it's so important is not just because it works, but because of side effects. All the drugs that we use that are used to treat ventricular rhythm disturbances have potential to cause fatal rhythm disturbances in themselves. They're what are known as pro-arrhythmic. So not something that we want to put ourselves at risk to unless we need to. The fish oil products, EPA and DHA, have virtually no side effects. There's a lot of information that has been suspected on the basis of bleeding because EPA is an anticoagulant. But in my experience, I've seen no one have a problem with fish oil where they've bled in any significant amount. Perhaps in a pre-surgical situation, you might want to let the surgeon know that someone's on fish oil, or if it's a real sensitive operation that could cause a lot of bleeding, maybe take them off. But it's good to know that it's well tolerated, it's safe, and it does a good job. So when we're looking at safe ways to manage health problems that have to do with the heart, particularly in someone who is at high risk for having severe rhythm problems of the ventricle or having a repeat heart attack, keep in mind that essential fatty acids are something that should be our first line of defense. If that doesn't do the kind of outcome that you'd like to see, then you can be thinking about adding drugs to it. But until that time, taking the safe road is what it should be preferable, because that's going to save a lot of lives and it's still going to get the job done.